Hey everyone, welcome back again to our series on managing pain during the opioid crisis. Again, this is based on the testimony we heard recently in front of a Senate committee by multiple people involved in this crisis. One of them was a patient, Ms. Steinberg, who is actually also a national advocate for improving policy, improving access to effective management strategies, effective treatment options for chronic pain. She talked about education as a big part of what we need in this country to better improve chronic pain management and to address the opioid crisis. And education can apply on a lot of different levels to a lot of different people and groups involved in not only managing chronic pain, but also involved in helping abate the effects of the opioid crisis. 4 levels and 4 groups that I'm going to talk about today are physicians, patients, lawmakers, and administrators. So first, physicians. We get very little, if any, education on chronic pain management during medical school, and that has been recognized recently, and I think there are efforts underway to change that. But that is so vital to understand, since the main reason, the most common reason someone presents to a doctor's office is for a complaint of pain. So it makes sense that we need more emphasis on this in our medical school education curriculum. Even as physicians get out of medical school and enter into training, there's very little emphasis on pain management, and oftentimes you learn as you go along on the job during residency. And that's appropriate. That's a big part of residency, is learning under people who are training you to treat patients. But I think more formal efforts at how we treat patients with chronic pain, more formal efforts on how is that done on a day-to-day basis are needed. Finally, then, when physicians are on their own in practice, that education continues. Of course, we all have requirements to get continuing medical education, but a big part of that needs to be, how do we treat chronic pain? And also, how do opioids figure into that? And there are some requirements coming that focus on opioid medications and the prescription of these medications for pain. But a collaborative effort certainly could be made on a greater scale to improve how physicians talk to each other, how we collaborate, how specialists such as myself, who are not present in all the areas of our country, especially the rural areas, can talk to primary care providers who see patients in all areas of our country and often struggle to find the resources from a specialty medical standpoint to address healthcare concerns. So for physicians, there's a lot of need and there's a lot of ways that we can improve this. For patients, it's so important to understand what it means to have chronic pain. Chronic pain is something that you will likely deal with on a daily basis the rest of your life. And so understanding that difference between chronic pain and acute short-term pain, such as when you stub your toe or have a surgery, and having that education inform your expectations for how you're going to live and function with chronic pain the rest of your life. And Ms. Steinberg had an amazing personal example of how she has learned to reorient her perspective of chronic pain through education when she established care with an empathetic physician and established that relationship to move forward together with better education on how to manage chronic pain. Another group of people that are important to consider are lawmakers, because they oftentimes determine some of the practice parameters and some of the ways that we can practice medicine in our states and in our country. And so this testimony by the specialists and by Ms. Steinberg in front of Congress was amazing. It was just an awesome example of courage to stand in front of lawmakers and to educate them on the realities of what it means to live with chronic pain and some of the challenges that we are facing as healthcare providers in addressing chronic pain. Finally, educating administrators and insurance executives who are in control of healthcare plans that address population level needs for healthcare. There can be some barriers to providing opioid sparing, multidisciplinary chronic pain management treatments. But those barriers can easily be overcome, I think, with more collaboration and more conversations with administrators, with people who run these programs to understand This is why we need to have this treatment and how we can improve function, improve production for that person in their life, improve their function and ability to live with chronic pain, even though it takes some investment in their medical care through these treatment strategies that we're proposing. So I talked about 4 areas where we can improve education: with physicians, with patients, with lawmakers, with administrators. And this is essential and was so vital that Ms. Steinberg brought this up during her testimony. And I believe we could all learn something from this testimony. And it was great to speak with you today about this very important subject in the management of chronic pain. Thanks.